Hello everyone, welcome back to this channel, and today we are going to be diving deep into healthcare marketing techniques. And this is one of the most regulated areas in marketing, and rightfully so, because in healthcare we are often talking about life and death situations and life and death decisions, so it should be regulated. And marketing in this industry can be quite challenging but also quite rewarding, because it means that we get to save lives if we are giving reach to awesome products that are making lives better and easier. My name is Dr. Stefanie Ginster. I have a PhD in molecular medicine, and I have worked in biotech and cancer diagnostics in marketing for quite some time. And now I've started my own business as a healthcare marketing consultant. Before we start, I am not a lawyer. Nothing in this video is legal advice. So if you are uncertain about the legal boundaries, consult with a lawyer and don't take this video as legal advice. So, all right, let's get into it. When people start a brand, also a healthcare brand, usually they tend to start with a logo or social media strategy or something, but this is not the place to start. Actually, this is the place where you end. It is more about how to understand the market landscape and also in healthcare, the market access landscape. This means, how can your product enter the market? Legally, we're talking about certifications, we're talking about certain legal boundaries, and also ideally, how can your product get reimbursed by health insurances? Reimbursement is really a game changer because it means that patients don't have to pay out of pocket anymore. And this is increasing the market size a lot. So I can only advise you to get a market access manager or a market access consultant on board as early as possible. This is probably one of the most important steps in your marketing strategy. Generally, the financial strategy is quite important. Usually, when we create a product in healthcare, we have this ideal in mind of helping a lot of people. And then we are suddenly confronted with the fact that money plays a huge role. We keep hearing this in the news over and over again. Healthcare is not just about curing people. It's also a whole economic system. In many countries, hospitals are private, which means that they also have economical interests. And the systems are really different depending on the country. So one example, and once again, I am no lawyer, I am no expert on all of those different countries, but given my experience in the past, I got the impression that the UK have a system that is more about cost cutting and saving money rather than earning money. Well, in Germany, very often there's an incentive for hospitals to prescribe procedures or drugs in order to earn money. So this is something that you have to know straight from the beginning. What are the financial incentives within the system that you're operating in? And know that the systems differ from country to country. Likely you want to launch in one country and then expand to other markets. And this is something important to keep in mind. Also very important to keep in mind is that likely, even though your product is made to make patients' life better or to make physicians' lives easier, likely your ultimate customer is going to be hospital management. Either they are the ones that are deciding on bigger investments that you buy once and then have forever, or also they will put pressure on the physicians, asking why there's not enough money there at the end of the month. And then the physicians have to justify themselves and have to justify their decisions. So even though maybe a physician is prescribing your product directly, they still have to justify this decision to the hospital management at the end of the day. So we can talk about strategies of how to deal with the situation in a different video, but today is more about giving a broader overview. And I've already scratched the surface of two other target groups that you might be having. On the one hand, it is healthcare providers, so physicians, nurses, etc. And on the other hand, it is patients. So let's start with marketing to healthcare providers, because marketing directly to patients is also very regulated in many countries. So how do you target healthcare providers? There are several different ways, depending on the size of your startup. Probably you don't have a large sales force yet. So let's focus on the other things first, and then also let's talk about sales and what you can do with that. If you want to get in touch with KOLs, meaning key opinion leaders, amongst physicians, I think congresses are always a great way to do this, because they are all together. And if you have a great pitch and they are speaking anyway at some symposium, it might be a good opportunity to talk to them there and to get some 5 minutes with them. And maybe you can convince them and have a follow-up meeting. But generally, you already heard it, identifying key opinion leaders is one of the most important things, because they might incorporate your product into their next talk. So for this, I also recommend that you do your research first and have an Excel sheet of all the key opinion leaders and what are the key opinions and areas that they are shaping, so that you know at the end, when you run into one of them, you know who they are, and you also know how to talk to them. Meeting people at congresses is like a very low price point, because it's like 500, 600 euros or dollars just to get access to congresses. Maybe your budget is a little bit higher and you might be able to have a booth or sponsor a symposium. That always depends on the packages, although my personal opinion is that a booth is not worth it in the beginning, but a symposium where you get to place your key messages is worth it. So if you're sponsoring and organizing a symposium, then you need to know in the beginning what is your core message. And based on this core message, you then get in touch with certain KOLs. And for a price that is in line with fair market value, we can also talk about fair market value in a different video. But once again, I'm not a legal expert. Yeah, but for a price that is in line with the fair market value, they can speak at your symposium about your product or the research area that is interesting to you and your product. And particularly if it is a new product, usually those symposia get a lot of traction, specifically if there is food involved. So if you're offering some sandwiches, this is always a good thing, but also sometimes in some countries this is not allowed. So also there, check for legal boundaries whether you're allowed to serve food or not. One third option is posters or even studies, although studies I know is going to be so expensive for you, so keep it in mind, but I won't be talking about this yet because this also has more implications. But creating a poster with a physician for a major congress is usually a nice way to get in touch with KOLs and also give them an opportunity to sharpen their scientific expertise and reputation. And it's also a great way for you and your product to stay relevant. If people are talking about your product, and if there's a physician standing next to the poster talking about your product. Obviously, there's also the option to target and sell your product through Salesforce. If you're having the budget to hire 1 or 2 sales reps, then this might also be a great opportunity. If the physicians want like a full service thing and want one contact person that they can contact all the time in order to solve their problems and answer their questions. So what would I do if I just started a startup with very little budget and still I want to launch a product? I would try to make sure that people talk about my product, and likely they will talk about the product if key opinion leaders are speaking about it. So probably the tier 1, so the top key opinion leaders, will be bombarded by all companies with lots of different core messages, and it might be difficult to get through those. So my strategy would to go for the second row of people that are hardworking, that are ambitious, and are still like advancing their careers, and to try to get a poster with those. If they are doing a poster, it is also likely, and if they are liking what they are finding, then it is also likely that they will be talking about your product in a different talk. And then in parallel, I would be working with a market access consultant in order to make sure that everything is going smoothly, legally correctly, and that you might get your product reimbursed. But all of those areas we just scratched the surface at. So let me know in the comments below if you want to talk about any of those areas in more detail. And I'd be happy to record a video about this as well. Now, I also mentioned patient marketing, but I realized this is a completely different space, so it takes another video to talk about it. Just to quickly sum up, there are different regulations as for everything per country, so it is so important to get legal consultants and legal advice as well. So in some countries you are allowed to speak to patients directly, while in others you are not. It also heavily depends on your product. If you are selling drugs or selling actual treatments, it is going to be very difficult. If you are selling medical products, then the legal landscape is a little bit more liberal. So because of this, very often you have to work with patient advocacy groups or other similar groups in order to get like an unbranded campaign on the way. But like I said, it takes a lot more than just this. So I am stopping this video here actually, And I will see you in part 2, where we are talking about how to do patient marketing. And by the way, what I would like to create here is a sort of network where you guys can also help each other out. So if you have a startup and want to connect with other startups, then maybe in the comments below, give us a few lines of what you're doing, what is your USP, what you need help with, and maybe some others will read it and you guys can connect. Let's go ahead and build a community of researchers that want to give reach to an awesome product. And like I said, I just started my own business 3 weeks ago. So in case you're interested in a behind the scenes look of how it's like to get things done. Like for instance, I just received my tax ID and now I can finally write bills. Yay. And those sort of things. Then follow me on Instagram or TikTok. My name there is also Dr. Stephanie Ginster. And I hope to see you there and see you in part 2. Bye.